CNN News Weekly. Today I have Jack McGrath, and he is going to be talking about mononucleosis. So Jack, what is mononucleosis?
Mononucleosis is a communicable disease. It's caused by the Epstein-Barr virus, or EBV for short. It is also known as human herpes virus 4. It is a member of the herpes virus family. Mononucleosis is one of the most common human viruses in the world. It's found all over the world, and most people get infected at some point in their life.
So you said this disease was communicable. How do people get it?
Mononucleosis spreads most commonly through bodily fluids, especially saliva. It's actually known as the kissing disease. It's also spread through blood transfusions, and it can be spread by using objects that an infected person has recently used, such as a toothbrush or a drinking glass. It survives on an object as long as the object is moist, and there's no evidence that disinfecting objects will prevent it from spreading. Mono can be spread for weeks and even can be in a person for weeks before symptoms occur, as is the case with, I think, my co-anchor here. Once the virus is in your body, it stays there in the inactive state. If it reactivates, it can potentially be spread to others no matter the time period between the initial infection.
So what are the symptoms of this disease?
The most common symptoms of mononucleosis are fatigue, fever, inflamed throat, swollen lymph nodes in the neck, enlarged spleen, swollen liver, and rash. Many people become infected during childhood, which usually does not make symptoms occur, but there can be exceptions to that. Adults and teens normally get better within 2 to 4 weeks, and they experience symptoms, this rapid decrease in symptoms. However, they do still feel tired for up to really 2 or 3 months. If the disease does reactivate, then it does not always cause symptoms though.
How do you get diagnosed for mononucleosis?
There's a very difficult diagnosis. It's confirmed with a blood test that detects antibodies in the blood.
Are there any vaccines to treat this disease?
There is no vaccine for mononucleosis. The best way to protect yourself is to not kiss anyone or share liquids or bodily fluids with anyone who has mononucleosis.
Is there a specific treatment?
There is not a specific treatment. To relieve your symptoms, I recommend that you drink fluids to stay hydrated, get plenty of rest, and take over-the-counter medications for pain and fever.
Thank you for joining us on CNN News Weekly. Thank you, Jack.
Thank you. It's been a pleasure.